Hey everyone, welcome to another episode from the Soapbox. My guest today is Dr. Amanda Donnelly, veterinarian, speaker, author, and business consultant. She's an expert on many different topics, but today we focused on the referral process. She wrote a white paper about the challenges of veterinary referrals years ago, and she's got a lot to say about what's changed and what hasn't. In this episode, we covered everything from communication to cost of care to setting appropriate expectations. Have you ever stressed over how much of a workup to do before referring, or how to talk to clients about the cost of specialty care for their pet? Those are just some of the topics we covered here. And we talked about the idea of connected care, where strong relationships are built between clients, primary care teams, and specialty care teams, with the pet at the center. So let's get into it. Without further ado, getting her time to talk from the soapbox, Dr. Amanda Donnelly. All right, Dr. Amanda Donnelly, thank you so much for joining me here today. It's so nice to have you on.
Yes, it's my pleasure. I'm excited.
Yes, I'm excited. We've been planning this for a little bit now, so I'm glad that the day is finally here.
Yes, me as well.
Yes, talk about all things referral. And my doggy may be making a few little appearances in the background, but hopefully he will settle down here. But yes, I'm so excited to talk to you about all the things that have to do with veterinary referral. We talk a lot about like the general practice or the primary care team and things from the specialty care team, and how we can work together and make things a little less stressful, a little more seamless for the patients and the families that we care for and that we're trying to help. And you've been writing and speaking on this topic for several years now, and I'm just really curious as to how you first became interested in the topic and sort of what the origin story is there. Would you share some of
Yes,
that with all of our listeners
yes,
here?
absolutely. Yeah. Well, my interest in building strong referral relationships between primary care teams and specialty care teams, as well as creating an exceptional referral experience for pet owners, goes back many years because I have actually been in both those environments. So I grew up in my dad's practice and then myself practiced as a primary care clinician for many years. But then I transitioned to emergency medicine and ultimately became chief of staff of a large emergency service that interfaced with specialists. So, what happened is that gave me this unique perspective of being on the side of referring cases and knowing what that's like, but then being on the opposite side of taking cases and working with specialists and understanding what that's like. So, I have this wonderful opportunity where I know the perspectives of both of those worlds and what the challenges are for both specialty emergency clinicians and the challenges for primary care clinicians. And so it's allowed me to see the referral process, ideally from all sides. And, as a pet owner, I've actually taken my pet now that I don't practice anymore to specialty care providers as well as general practitioners. So that's really how it all came about, is me having lived in both of those worlds.
Yeah, it's so important, I think, to have those unique perspectives as someone who's not in clinical practice very much at all, either now being that and the pet owner perspective now, it really sheds a lot of light. So that's so helpful that you have both the primary care and the specialty care um, standpoint to be able to talk about it in an informed way from both of those perspectives. Um, and when we originally kind of chatted on this topic, you mentioned that there were some logistical terms that you wrote about years ago in terms of referrals, um, and that some of those same concerns continue to be ones that we sometimes struggle with in our industry. Can you help us understand what some of those challenges are?
Yes, and that's again a unique historical perspective I have because over 15 years ago, I did this project with AHA, and it was looking at the referral relationships. And at that time, what we did is we hosted a series of meetings across the United States in different cities where we invited specialty care providers to come together and primary care providers to come together and share their thoughts and their ideas and their challenges and their perspectives on their working relationship. And what's interesting about that is some of what we talked about them, and I actually wrote a white paper, which still exists today, um, about some of those challenges. Some of those challenges that we talked about over 15 years ago are still relevant today. One of the ones that I wanted to bring up is the concept of refer the patient or refer the consult versus refer the procedure. And the reason that that's so important is what can happen is a primary care doctor might refer a client over to the specialty care hospital, let's say for an ACL surgery, or refer the patient over for, say, an ultrasound. But then the problem that could come about and does come about is sometimes is that then the patient gets there and the specialist decides that either there's a different test that they want to do or a different condition that needs to be worked up in a different manner. And then what happens is that can lead to some miscommunication. And now the client was expecting one scenario and they have a different scenario. It can even erode trust. And so that's the problem that can come about. I've also heard specialists say that they don't want a veterinarian to refer and give them like a to-do list. This is what I want you to do for this patient. So instead, just like years ago, right now, we really very much want to promote the idea of reinforcing the value of the consultation with the specialist and refer the patient, for that consultation. Not to say that we wouldn't still say this is what we think they're going to do and these are the services they'll likely provide, but to not refer for a specific procedure. The second very relevant challenge that specialists have that they still talk about today that they did many years ago is the need for a written medical summary. So what can happen is veterinarians might send pages and pages of medical records that now the specialty care hospital has to comb through all of those and figure out and get up to speed with what's going on with the patient. So what they want is for primary care veterinarians to give them a succinct written summary, essentially like in a SOAP form. What are the subjective clinical signs? What is the assessment to date? What has been done to date? What are the treatments? And not just what are the treatments, but also include all the lab findings and diagnostic reports, include the medications, including the dosage and the frequency of medications, everything that's been done, and what are they specifically looking for in the consult. So if they have that brief summary, then it makes it a lot easier to have that continuity of care and that seamless referral process. And it creates a tremendous increase in efficiency for that case being worked up, appropriately. So I would say those are probably the two biggest challenges that we talked about years ago that we're still talking about today. And then I think overall, the last component would just be still the need to prepare clients for the idea, for the cost, for the referral process that was important years ago, still important today.
Yeah, I can remember having some of those conversations that you just mentioned with clients, before a referral where they would say, okay, so when am I going to have my ultrasound? When is my pet going to have the ultrasound? And I would say, well, I'm referring you to a different doctor and they're going to decide if an ultrasound is appropriate and let you know what they think they should do. And I trust them. Because you're right, they would, clients understandably would get in the mindset. I'm like, okay, my doctor is saying this is what I need, so I'm going to get this referral, and then I'm going to go get what they say I need.
Right.
And it can be sometimes a little confusing for them if they don't have that expectation that actually someone else is at least temporarily taking over the case.
Right. And then I think it's important also to remind the clients that you'll keep in touch, with the specialty hospital.
Yeah. Yeah, that's very helpful. And I'm sure I know a lot of things have changed over the years just with our ability to refer, but like, what would you say are some of the big ones in terms of like you said, some of these things have kind of stayed the same, or at least things we still need to be aware of. But like, what has changed with referrals over the years? Like, what do you think has changed?
I think one of the aspects of the whole referral process that's changed that is wonderful is the use of technology. So, for example, if you go out and you look at most specialty care websites, they'll have a link that will talk about their referral portal. So most, it's certainly all the large specialty hospitals I see this, and I would recommend that any specialty hospital of any kind or urgent care have a referral portal, meaning that all of the primary care doctors can then easily upload medical records. They can upload all the lab tests. They can email back and forth. So that technology has helped. I think there are certain instances also where we're leveraging more telehealth with specialists that they might not have the opportunity to see the patient, but could have some sort of telehealth component, or also, of course, be communicating with the referring doctors on a case. I also think what has changed over time is I don't hear as much now today about any reluctance to refer cases. That was talked about a lot more years ago about primary care veterinarians wanting to hang on to cases, to not lose income by referring a patient to a specialty hospital. I don't tend to hear that or see that much, anymore. I think there's so many specialists out there, and veterinarians are certainly busy enough that they're not reluctant to refer. What has absolutely changed, though, in the last 15 years is the tremendous wait times that sometimes exist to even get in to see a specialist. That's particularly true for certain specialties, maybe like cardiology. There's not as many cardiologists, for example, so it might take a long time to get in to see one. I personally experienced this with my own pet. I have Gidget, a long-haired dachshund, and she had a very serious illness in March of this year, was in critical care. We thought she might need surgery, but it was recommended, and I live in Nashville, it was recommended that just to get a second opinion, that I see a soft tissue surgeon, well-known soft tissue surgeon at the University of Tennessee specialty center. And it took me 3 months to get an appointment for a surgical consult because she wasn't, critical. She was stable. And so the long wait times with any specialist. Now, more recently, I had to wait only about 10 days to get an ultrasound. But back, when I was practicing, it didn't take you 10 days to get your, a dog seen for an ultrasound at a specialty care hospital. So the long wait times has been a significant change. And so now, because of those wait times being so long, if a patient is more critical, and I also experienced this personally, to get to a specialty department, you have to go through the ER. So when Gidget was sick in March, she went to the ER initially, but went back to the primary care veterinarian. When it became clear that she needed specialty care, she had to go back through the ER to be transferred then internally to the internal medicine department. So that, of course, is frustrating for everybody. It's just the nature of where we're at, but definitely a change.
I'm wondering what you're seeing in terms of how much of an obstacle cost is to referral for a lot of pets and families.
Yes, without a doubt, the cost of care is a primary concern just about veterinary care in general. And of course, with specialty ER bills tending to be higher, it's a huge cost, or it's a huge concern for pet owners. Interestingly, Synchrony partnered with Care Credit to look at this very topic and then publish their findings in their veterinary specialty care study. And they were looking at the perspectives of pet owners and then the perspective of specialty care providers. And I thought one of the most eye-opening findings from that study was that 72% of pet owners said they were very or extremely concerned about the patient outcome, which makes sense, but also equally 72% said that they were very or extremely concerned about the cost of care. So we have people now that are just as concerned about the cost of care as they are about how their pet's going to do. Again, personally, I can tell you that, when Gidget was so sick in March and, it was potentially life threatening, I, of course, was very concerned about that. But I will say also, I had a tremendous increase in my anxiety as well because of the cost of care. And for the first time going, oh, wow, like this is a lot. And is there a point where I would have to say, I can't afford any more? And so I can appreciate that. I think we just have to recognize that this is a very relevant topic because veterinary fees have, and I've heard statistics that they have doubled in the last 7 years, but we for sure know veterinary costs all across the board have skyrocketed in recent years.
Yeah, yeah. I mean, I think it's just being talked about so much in every sector of the veterinary industry as we probably need to continue to talk about it. Um, and I think, primary care veterinarians, having been in general practice, I personally have never worked in the specialty side of things, but having been a veterinarian who for many years was the one recommending referral, and sort of initiating that referral for my patients and their families, um, a lot of us, all of us, I'm sure, are very aware that cost can be a barrier and, like you said, a stressor, a cause of anxiety for families, and we want to do everything that we can to reduce that stress and try to remove that barrier if we can. So I think a lot of times I can only speak for myself, but I know personally I have kind of gone back and forth in terms of like how much should I do before referring, you know? And particularly when I was working as an associate at a clinic owned by someone else, my boss who was older than me would say things like, "Oh, well, do as much as you can here in GP because we get the revenue from that. Like keep at least some of that revenue in the practice." And he would say like, "Oh, it's probably cheaper to do x-rays here than, you know, at the specialty clinic." So you're helping the client too. But then I would always worry, orthopedic surgery, for example, I'd worry, okay, well, I have heard plenty of times where I take the x-rays, I send them off, and then the client is mad because they go off to the specialist and the specialist says, "Well, I didn't like those x-rays. So now I'm going to take my own." And the client is like, "Well, why did I pay for them to be done twice?" You know? Um, and so we're in this place where, okay, we want to do right by the family. We want to try to help them save money wherever we can. And I can remember other instances. I think the one I'm thinking of was sort of a dog that I suspected had IVDD, and we were sending them to neurology. And I was trying to send them as quickly as possible. And I remember being on the phone with the neurologist and telling them what we had done. And they had said, like, you didn't take radiographs. Like, you haven't even done that yet. And there was that sense of like, you're not you're not sending the pet with everything I need to really know what to do. So we kind of want to strike that balance of like maybe not doing things that they'd be better off waiting to do, at least from a like a financial standpoint, and letting the specialist do it the way they want to do, so the client doesn't spend more money than they have to, but also doing what we can to give sort of the full picture to the specialist to feel like we've sort of done our due diligence with our initial workup. Um, so do you have any advice for practitioners who are sort of struggling with where that line is and sort of how to approach making some of those decisions?
It really is that balance, as you said, about, what do I do before I refer the case and how much do I do, clinically before I refer a case. And this answer that I have is not a magic bullet, and it is not easy, but the clear answer is to increase and improve communication between primary care veterinarians and specialty care doctors in terms of case workups. So, what I mean by that is having those conversations over time to get a sense of what the specialists want you to do so that then you can try to use that as the model for, and then know for those types of cases what you would do. So, for example, with respect to x-rays, from my standpoint, even if they needed to repeat some x-rays because of the views that they might want to take, I think you would still, just to even get a diagnosis yourself, you would still have to take the x-rays at the primary care veterinarian. I think that's going to fall into that category of sometimes tests need to be repeated. There are other situations, however, that sometimes primary care veterinarians might not be aware of, which is what drugs do we give before we refer a case. I just heard a criticalist talk at the AVMA meeting on this very topic, and she talked about how certain pain medications, for example, that a primary care veterinarian might use would not work well and would actually be contraindicated for the pain medications and the drugs that they would want to give at the specialty hospital. Likewise, she recommended that trying to avoid giving antibiotics if you're going to refer the case right away, because they might want to give something different or do some testing where they don't want the pet to have had antibiotics. So really what it boils down to is, even though doctors are really busy, not forgetting that gold standard, which is primary care veterinarians, if they talk on a regular basis with specialists, can find out more about how they want cases referred, what tests do they want done. Another example would be doing an ultrasound at the primary care veterinarian, like a fast scan, which is a great tool. But if you're charging the client for that, and we know it's going to go over and likely be like an internal medicine case and need an ultrasound at the specialist, that's not going to be ideal, because then we know that the internist or the radiologist is probably going to do that ultrasound there. So it really is that balance, as you said. There's no easy answers other than looking for all those opportunities on a regular basis where the doctors can talk. How do you want this type of case, referred? What are some of the do's and don'ts about how far I work up the case? And then lastly, what I will say is that while specialists may not want you to do certain tests because then the client would incur more cost, without a doubt, and this was talked about years ago and is still referenced today, is that specialists really encourage doctors to make sure they have fully worked up a case when you have a weekend coming. Because, we want to avoid any situation where a case is referred or transferred, like say on a Friday, and it hasn't been completely worked up. And now that specialty, team or that ER team isn't going to, be able to do everything that they could have done had the case been referred earlier in the week. So I think that's another important, point to bring out.
Yeah, that's very helpful. I think another thing that I tried to do is just communicate with the client and say, hey, this is why I'm making this decision. And there's a possibility that the specialist may repeat some tests that we've done. And here's why they might want to repeat it. Just to try to reduce some of that shock,
Right.
that
Kind of smooth that
misunderstanding,
transition.
say, kind of like set expectations for what could happen and reasons why, just like we might repeat blood work every day on a pet who's hospitalized. Like, why are we doing that again? Oh, well, because we need to see what happened. Is anything changing? Is it getting better? Is it getting worse? Is it staying the same? The same kind of thing. So yeah, I like that idea of just, because you can't like set out guidelines for every single case. If you have a TPL, no, or if you have a cruciate tear, do this. If you have an IVDD, do this. It's going to be very dependent on the specialists and how quickly they're being referred and the state of the patient and all of that kind of thing. So just being able to have those opportunities to talk and communicate and ask those questions. And just kind of going back to sort of setting the expectations for the client, how important is it for the primary care team? We talk about, the fact that we're referring the case and that someone else is going to take over and that they might want to do these tests, and here's why. But then another thing that we often have to talk to them about ahead of time is how much it might cost. So how important is it for the primary care team to have that discussion with the client before the referral. And I don't know if there's anything you can add about what that discussion should look like or what should be included in that discussion.
Yes, the talking to pet owners about the cost of care is imperative, especially in these times we're in where we know the cost of veterinary care, at times can be relatively high. So we definitely want to have the primary care team talk to pet owners about the potential cost. What's important is how we present that information so that we don't scare the client off seeking emergency or specialty care. And the goal is to give pet owners a realistic idea of the cost of going to the referral center, the value of getting the consultation once they're there, and that there will be payment options available. With respect to, well, what is the idea of the cost of care? First and foremost, I've always advocated for letting them know the cost of just walking through the door. What is the cost? And these are easily, you can easily keep track of these costs. Just call the referral center or, and know what is the specialist office call fee consultation? What is the ER consultation fee? So tell the client you'll incur that fee, but then before they're going to do anything, they will give you a treatment plan with associated costs. So we want to really reinforce that value of just getting the consultation and seeing what your options are and talking about treatment plans and prognosis. Now, if we know that the pet is likely to have a specific test or procedure, it would be important to give people ballpark figures. For example, years ago, I had a Papillon who was older, 12 years old, when she started having seizures. A brain tumor is a very likely diagnosis, and the procedure is going to be an MRI. So it wouldn't really make sense to not tell the client what an MRI might cost. So there are times like that where we can give people ballpark figures of maybe, 24 hours of hospitalization and specific tests, but really reinforce that that they need to start with just that consult. And then lastly, what I would say is, years ago, I heard this, and I still hear it now, that specialists will say that they don't want primary care veterinarians to say that specialty care is expensive. They don't like that word expensive. And I think that that's a fair point, because if we say it's expensive, that immediately puts the focus on money rather than patient advocacy. It sounds negative and it might scare someone off. But we also then put ourselves in the position of judging potentially someone's ability to pay or their willingness to pay. So instead, the best approach is to say that if we recommend the referral or that the pet needs to go to emergency care, tell the client that and say, we do want to prepare you for the costs that might be involved. Give them those costs if they're known, and then immediately bridge to the fact that there are payment options available. So the focus then would be on patient care and payment options, not that something's going to be expensive. Because I think also, as a primary care doctor, if you say, well, this is going to be really expensive, what the client tends to hear with that is that you're not really standing behind that referral, that you don't think that it's valuable because, oh, it's expensive. So I think that's a fair point to be careful on the wording. But absolutely, we do want to talk. It's imperative, I think, and this came out of the care, or the veterinary specialty care study, is that in order to properly prepare clients, in many instances, that starts with primary care teams telling clients about the potential cost of care.
Yeah, that makes sense. I remember being told years ago, to avoid using words like, saying this drug is cheap, for example, or this procedure is cheap, or anything like that, because it um, sort of indicates like a lack of value.
Exactly.
And I could see
Yes.
how expensive would kind of be the same thing, like you're kind of paying a lot for what you get, kind of thing.
Exactly.
Sort of belies the perception of value, um, sort of on the other end of the spectrum. Um, are there ways that you hear people talking about sort of ways that like primary care team members can kind of validate a family members or a pet owner's concerns about the cost of care, without using the word expensive, saying things like, I understand that this may be cost prohibitive for some people, or like, are there other phrases like that you hear used that you think are more appropriate?
Well, I think actually what you hit on there a little bit that we haven't touched on is how important it is through this whole financial care conversation to express empathy for the pet owner so that it's not this transactional conversation. And so that at that point, before we even, it's not just the words about whether it's expensive or not expensive, or whether there's payment options or not payment options. I think sometimes teams forget to just express empathy and start by saying, we're so sorry, or I'm so sorry that Gidget is sick. I'm so sorry you're in this situation. And let that sink in with the client so that they, take in that empathy and know that you care about them and their pet. And I will say that with all my trips to the specialty and ER that I've had this year, there was no question that I felt like everybody cared. The actual verbal expression of that empathy, though, I didn't hear hardly at all. And so it's not saying that they weren't empathetic through their looks or just, very professional and friendly. And I was in particular, interestingly, impressed with the client service representatives that I came across at times at the specialty hospital. But that actual expression of empathy is so important. With respect to how we word the cost of care, I think just continuing to say there is a level of cost that we want to make you aware of with, just saying it with no judgment. And then again, very quickly, I think bridging to there are payment options. The best way I think that we can make people comfortable with the cost of care, the number one way is to let people know that there are payment options that will help them spread out the cost of care over time. And that will tend to give people some measure of comfort and peace of mind. And we know, again, through veterinary specialty care study, that pet owners said that they would be anxious with a specialty care bill. 100% of them said they'd be concerned with a specialty care bill of $2,500. And a lot of specialty care bills are more than that. And of course, some people said, they would be extremely anxious at lower price points. And we also know that only 25% of specialty care providers thought that pet owners had a realistic expectation of the cost of care. So we know that there's this disconnect between what people know and what they might be expecting and what they want to know versus how much we're preparing them. So I really think empathy combined with transparent, honest conversations, that's your financial care combo that I think is so important in these conversations. Empathy and talking about, transparently, this is the cost and there's payment options.
Yeah, I like that empathy. And then you said at one point, just ex- expressing the information or delivering the information without judgment, as to your judgment as to cost or feasibility and that kind
Yes,
of thing. And then
and
offering those options.
and one more piece of this that I thought was really interesting. I spoke last year at the internal medicine meeting, ACBIM, in June, in Tennessee, and one of the specialists made the comment in the Q&A part of my presentation about the importance of that consultation. And she essentially, even though she didn't use the word spectrum of care, she referenced that because she said, many times if I can get the patient, I can talk to them about something that I can do to help their patient. So it was that idea that I think sometimes we think, transferring a case to a specialist means there's going to be these enormous bills, when in reality, that's not always the case. And that there are options that, we can look at, well, what's affordable for you or what's the best, option for your family. And I know that there are specialists that absolutely will do that. And so I think we don't want to lose sight of the fact that everybody does have a different level of affordability or what they consider affordable. But by the same token, I saw people in the waiting room when I was at the emergency hospital that looked like they had no money. I mean, just judging them by how they looked, I would be like, "Ooh, I don't think they're going to be able to afford care." And yet they were saying yes to a very, more advanced level of care. So I love your comment about we need to make sure we're not judging people on what they can afford, but instead really focusing on, here are some options. This is what we recommend, and working with them to get the best treatment for that family.
Yeah, and I loved your comment, that you heard back from that specialist who said that in a lot of cases, they just want you to get the pet to them, get the family to them so that then they can kinda go over the options and that they're often able to be able to do something. Um, how important is it or what can the specialty care providers do to I'm sure there are a lot of things, but, like, what do you consider to be the most important things that, specialty care teams, specialty care providers can do to, um, help families, um, understand, uh, what is being recommended and sort of reconcile with the cost of care and be able to come to some kind of decision that, results in a level of care that is feasible and affordable to them and allows their pet to get some care.
Yes. The number one action that specialty care providers need to take to help people understand and hopefully afford care is to proactively share payment options. And they can do that a number of ways. First and foremost is to post on their website the payment options that they have with links directly to that company so that the pet owner can go and see if they can apply for those options. That's number one. Number two is to share that information that they have payment options through texting. So, for example, that might be texting reminders. For example, I scheduled my ultrasound, my internal medicine consultation and ultrasound that was 10 days out, and I did get a reminder text. That would be an important point to put embedded in that text if you have need of payment options, either to call us or, to give them a link to a payment option. And there are many specialists that see cases on a regular basis. For example, if they're, monitoring an endocrine case or chemotherapy patient, for example. So the text reminders. Also, there are texts that come out to ask the client for more money. When Gidget was in the hospital, every day that went by for a couple of days, there was a new test that needed to happen. And then she had more time in the hospital, which meant I did have to give them some updated, payments. And so when I got those texts, it was really convenient to be able to just pay through the text, but that would be another time to embed within that text, we have payment options, and to give them that information. But then lastly is what happens in the actual specialty hospital. And so what I've seen over many years' time, including my own personal experience recently, is specialty hospitals will have signage. That might be the tent cards or some sort of a plaque that will be in a couple of places, maybe like in the reception room, may or may not be at the front desk, that tells them that they have payment options. And certainly wherever that posted signage is, should have the QR code and have the client be able to easily go sign up for the payment option. But here's what I will say. I did not see that signage in every exam room that I was in. I can remember sitting in an exam room for like an hour at one point in time, and there wasn't much to look at, and there was nothing in there about payment options. I can also remember checking out at a desk where there was no signage about payment options. Moreover, nobody in all of my time at the specialty ER this year verbally mentioned payment options to me. Now, that could be because I'm a veterinarian. Having said that, I have a neighbor, good friend, who took her dog to the emergency hospital, and ultimately her dog was in critical care for several days. When she got the initial treatment cost and was very emotional, Nobody said anything to her until she got to the front desk. And then the client service representative, seeing how upset she was, mentioned that there was payment options. Now, I had told her about payment options, so she knew. What I'm conveying here is that what I see is this lack of proactively verbally saying to the clients, having specialty team members verbally say, we do have payment options. Now, the doctor doesn't have to go into that, but the doctor might say, we do have payment options. My team will talk to you about that. The technician, even if they need to immediately get to the back, could express empathy and say, we absolutely have payment options that can help, spread out this cost of care. Let's have Molly talk to you about that. I do think in many instances it would be better to have somebody come into the exam room to talk to the client about that payment option, as opposed to being at the front desk where you're looking around and you see, there's all these other people in the waiting room standing at a front desk to talk about a payment option. That's not the best scenario.
Right.
But my point here is somebody all along the way in that process on the specialty care team needs to be very proactive about presenting those plans, not waiting for a client to say, I can't afford it, not waiting for the client to cry, not waiting for the client to defer care.
And you mentioned spectrum of care, which is something I didn't have a specific question about, but I'm curious to know, is that something I assume the answer is yes, but I haven't really thought about it before. Is that something that is coming up a lot in you attend conferences where a large number of specialists are likely to be speaking and attending? Is that something that's coming up a lot in specialty care circles in terms of spectrum of care at the specialist level?
I don't hear that talked about at the specialist, at least not the term spectrum of care. And I don't hear that talked about as much. I think that term spectrum of care, we do tend to hear it more, with primary care practices. Having said that, the idea of shared decision making and talking to the client about what they can do and what's best for their patient. Yes, I do hear that or see that advocated by specialists. I wouldn't say it's a huge topic of conversation at all, but I do see it, a little bit for sure.
I can definitely think of cases looking back now where I can recognize that the decision that was made, like you said, the shared decision making definitely was a spectrum of care decision where the client and the patient went for referral and were not able to accept every recommendation that was made, or decided it was too expensive to go back to the specialist for all the follow-ups and ended up doing some of it back in primary care as sort of a it maybe was not was originally what was originally recommended, but sort of a compromise that definitely feels like a flavor of spectrum of care when I think about it now,
Right.
whether
Yeah.
it's noted as such or sort of recognized as such or not. Um,
Well, I sort of did my own spectrum of care for Gidget when she was sick in March, because I just thought she had some sort of initially gastrointestinal problem, just needed IV fluids. So when she first went through the ER, I actually declined any lab work because she had recent lab work and I thought she just needed to be camped out overnight on fluids. So I declined some of those critical care components that just naturally go along with, having a pet, at the emergency hospital. But then the next day, when it was really clear that she had some very serious abnormalities and was at risk, I didn't, I didn't decline anything. I accepted all of the recommendations, that were related to critical care hospitalization. But I had the advantage of being a veterinarian. The most pet owners don't have that advantage and it's not easy for them to make those decisions. So I do think that there's a way in which we do need to be careful that we don't price out any level of care, to only people who, have a certain level of income that, and that's where that spectrum of care, I think, comes into play.
yeah, for sure. Um, and I feel like we've kind of covered this a lot, but just this idea of like other ways that we can help family members, clients sort of become more comfortable with the cost associated with referral. I mean, you talked about the importance of emphasizing, or at least not saying things that might undermine the perceived value of the care that they're going to receive, and talking about payment plans earlier and more frequently. Are there other steps that either primary care teams or specialty care teams can take to sort of help the client become more comfortable with the cost associated with referral, or understand the benefit in, let's just say, referring a case earlier versus, kind of waiting longer, you know, seeing how maybe they might save money potentially for going for a referral earlier versus, kind of trying to stick with the primary care team when perhaps there's something else that a specialty care team might be able to do that a primary care team can't offer as easily. Are there ways to help the family at least be informed in their decision making about that so they feel comfortable in the decision that they make?
Yes, I think sometimes what happens is what we don't want to have happen is have everything focused just on money. So if we only say, oh, well, there's a level of cost associated with this, and that's going to be that, and we have payment options, the missing piece there is, well, what's the actual benefit of this care? And benefit is the key word. I have for some time now been really advocating to replace the word value with the word benefit. So if you say, well, the value of this consult or the value of this care, there's nothing wrong with that terminology. But what the client wants to know is what's the benefit? In other words, what are the benefits to the patient? What are the benefits to me personally? So, for example, because that's going to really resonate with a pet owner and help them really understand why we want to go, to this level of care. So the benefit might be that the pet's going to feel better quicker, that the pet is going to get out of the hospital quicker with certain hospitalization or level of care, better prognosis. That's certainly a benefit. Definitely the benefit of longer life, happier life, ultimately, the bond. So what happens sometimes, and I think I don't necessarily see this as a problem with specialists. I think specialists are really good at saying, here are the benefits of doing this particular test or this particular surgery. But I think the primary care team needs to support that as well. Both teams need to use the word benefit and say, here's the benefit of going to the specialist, the benefit of finding out what's wrong, the benefit of everything. So I can't stress that enough, focusing on empathy, the benefits, and then, bridging to the cost of care. And one of the topics that we haven't talked about is how do we create a more seamless referral process or that transition? And that's where I advocate having a referral liaison at both practices, but in particular, I think most specialty hospitals have those team members. I don't always see that at primary care practices. So having that designated one or two team members who actually have that job duty where they're the point person for that primary care practice for everything related to the referral. They would be responsible for making sure records are being transferred, that the medical summary has been communicated to the referral hospital. They're that point person for answering questions for the client. They might be the point person for talking to the client about some of what they can expect at the referral practice in terms of cost, maybe long wait times. And then lastly, that they would advocate for that, just that to have heightened in communication between the specialty care practice and the primary care practice.
I love that. I feel like that could make such a difference in helping all other parties feel more sort of connected and up to speed with what's going on. And like you said before, in terms of how much stress and anxiety can go along with it, particularly from the pet owner's perspective, reduce that for them. And allow the other teams to do what they do best. So yeah, I think that's such a great point. Um, well, I really appreciated going over all of this with you today. I feel like I've learned so much, and I love the points that you've highlighted about using the term benefit over value. I think that's such a great thing to keep in mind to help that family really understand why we're making this recommendation, and that we really believe that it is a potential benefit for their pet. Um, so I'm excited for everyone else to be able to kind of join in this conversation, listen to what we've said, and kind of bring this back to their practices and see how they can incorporate some of this information. But I'd love to know something that you are excited about in veterinary medicine. I like to ask all my guests if there's one thing that you can think about that you're excited about, either that's happening right now or something that you're looking forward to in the future um, within our field.
Yes, well, this is not gonna be a shocker for anybody. I get very excited about client communications. I always have, but I continue to have a passion for client communications and be excited about that for the future. And the reason I say that is I do see an increased um, focus, maybe even a reset in certain circumstances where we're talking more again about collaborative care models, shared decision making, spectrum of care. We're putting more focus now on the importance of financial care, and also that idea of connected care. That the importance of communicating, between the pet owner, the specialty care, and the primary care team. And so for me personally, I'm excited to continue to help teams, veterinary teams, learn these skills that they can use with pet owners, and also leadership teams implementing training programs. So that's really the focus of my excitement and being able to continue that journey of speaking and consulting and training in this space.
I love that. I love that term, connected care.
Yes, yes. And can we just real
Yeah.
quick talk about
Yes.
before we
Yes, I was
because
gonna
I just
ask you for any final thoughts, so please share with
yes, so
us.
that is a final thought that we actually just didn't come up. Connected care is not new, but the term I think connected care is new. And so connected care is means that specialty care teams and primary care teams working together to help as many pets and people, excuse me, as possible. But the foundation of that is what we call the triad of care. So if you think about the triad of care, that's the pet owner, the primary care team, and the specialty care team with the pet in the center. So it's all the caregivers working together to help the patient, as much as possible. So that whole idea of connected care is this idea of collaboration, everybody working well together. So that's really what I'm trying to promote. I know great organizations trying to promote that, as well as individual, clinicians all across the board in all aspects of veterinary medicine. And if our listeners want to know more about that topic, Vetfolio has a course that you can do on demand. Is actually me talking on this topic of connected care, and that's called "Helping Strengthen the Bonds Between Primary and Specialty ER Care." Or specialty ER practices. So that's on Vetfolio. I also do want to remind everybody about the 2025 AHA referral guidelines, which are very extensive and have so many best practices and ideas and really important structure and foundation for developing these relationships. And so I would refer everybody to the AHA website for that information.
Thank you so much. Thank you for that call out, and for all the resources and all the work that you've been doing on this topic. I feel very inspired and really appreciate your time.
Yes, thank you. And if anybody wants to reach out to me, the best way to do that is just through my website, which is amandadonnellydvm.com.
Awesome. Thank you so much.
Oh, thank you so much for having me.